Hmm. Yes. हम्म और पिछले जो एयरटेल मैम वाला लेक्चर था उसमें वीडियो तो हो रहा था लेकिन पीपीटी अपलोड नहीं हुआ। उसमें मैंने बस जो मेरा मेमोरी बेस था ना मैं कुछ लिख के भी नहीं ले रही थी वजह से ही फिर मैंने आज इस बार लिख लिया।
सत्यं च एव निरतं रोगं विदुतम् अन्वेषितं च सविधि आरोग्यमस्य गुडं निगूढम् औषधरूपं धन्वन्तरं च सततं pranamami nityam. Let's start the session by bowing down to Lord Dhanvantari. A warm good evening to one and all. This is Swati Priyavi from Dharma Ayurveda Medical College. It gives me immense pleasure to host today's Ayurveda digital learning session conducted by I Ask Ayush, streaming partner by Digrama Healing Village. In this wonderful evening, it's my honor to welcome our proud speaker, Dr. Sangeeta Verma MA, MD Swasthabrata. Ma'am has completed her UG from SRM State Ayurveda College and Hospital, Bareilly, Uttar Pradesh, and her PG in Swasthabrata from RGP Ayurveda College and Hospital, Prapola, Himachal Pradesh. Currently, she is an assistant professor in the Department of Swasthavrata in the most prestigious institution, National Institute of Ayurveda, Jaipur. She has an experience of about more than 10 years as a medical officer in Uttar Pradesh. Ma'am is well known for her bold talks and her ability to fade away the pains and agony of her fellow students. On the behalf of the team of I Ask Ayush, I, Swati Priya, wholeheartedly welcome you to today's session, ma'am.
Thank you, ma'am. Thank you, ma'am. A very good evening to respected sir and all the audience here. Today, I am going to present my lecture on a preventive approach towards cancer. So, why I choose this topic? First of all, I would like to share my experience with all of you. That nowadays, as we know, in the changing scenario, cancer is the one of the biggest challenges in health sector. So, being from Ayurveda fraternity, it is our responsibility also to contribute in this sector, enhance the health of the people. So, I choose this topic. Okay, I'm starting. So, what is the cancer? According to WHO, should ma'am please change the slide. Yes. According to WHO, cancer is a large group of diseases that can start in almost any organ or tissue of the body when abnormal cells grow uncontrollably, go beyond their usual boundaries to invade adjoining parts of the body or spread to other organs. The latter process is called metastasis and is a major cause of death from cancer. It has been estimated that 30 to 40% of all cancers can be prevented by lifestyle and dietary measures only. Obesity, nutrient sparse foods such as concentrated sugars and refined flours products that contribute to impaired glucose metabolism, low fiber intake, consumption of red meat, and imbalance of omega 3 and omega 6 fats all contribute to excess cancer risk. Intake of flax seeds, especially its lignan fraction and abundant portion of fruits and lower cancer risk. Allium and cruciferous vegetables are especially beneficial, with broccoli sprouts being the densest source of sulforaphane. So, protective
Ma'am,
elements in a
excuse me,
cancer
ma'am.
preventing diet include, yes, ma'am.
Ma'am, your video is
Yes,
not visible,
actually,
ma'am.
what is not visible, ma'am?
Your video.
Yes, ma'am, my video is not visible. It is visible with my phone, but with my laptop, it is not visible. I'm doing it again and again,
Okay, ma'am.
but
Okay,
it's
ma'am.
not working.
Okay, ma'am.
So, ma'am, I will read this my PPT and we can see the PPT only. We have to do
O-
it.
Okay, ma'am.
Yes, ma'am. So, ma'am, please change the slide. So, common names, as we all know, the neoplasm and malignant tumor. Ma'am, please change. So, what is the Ayurvedic concept regarding the cancer? According to Charak and Sushruta Samhitas, cancer is described as inflammatory or non-inflammatory swelling and mentioned earlier as granthi or arbut. Aggravated Vata and Kapha doshas affect the tissues, resulting in development of a round, firm, large, deep-rooted, slow-growing, fleshy growth associated with mild pain. Six types of, ma'am. Next slide. Next slide, ma'am. Six types of tumors have been described, as we all know: Vata, Pitta, Kapha, Medod, Mansaj, and Raktarbuda. Among these, Mansarbud and Raktarbud are described as incurable, and these are the malignant tumors. So, severity of the cancer. Cancer is second leading cause of death globally, for an estimated 9.6 million deaths in 2018 and 10 million deaths in 2020, or 1 in 6 deaths according to WHO. It is emerging as the biggest load on our government. That's why our government has also included prevention of cancer in his health programs. What are the common sites? Common sites for men are lung, prostate, colorectal, stomach, liver, and for women it is breast, colorectal, lung, cervical, thyroid. So, what causes cancer? On review, cancer arises from the transformation of normal cells into tumor cells in a multi-stage process, but generally progresses from a precancerous lesion to a malignant tumor. These changes are the result of the interaction between a person's genetic factors and three categories of external agents. Uh, Next one. These external agents are physical carcinogens, chemical, and biological. Physical carcinogens like ultraviolet radiation, chemicals, asbestos, alcohol, tobacco, smoke, aflatoxin, and arsenic. Biological carcinogens include infections from certain viruses, bacteria, and parasites. So, what are the probable signs for early detection of cancer? It is under Caution, Caution. C for change in bowel or bladder habit. It means a sudden change from your natural bladder habits. Whenever you see a sudden change in your bladder habit, it is a alarming sign. A for a sore that does not heal. It means a sore that does not heal from 2 to 3 weeks or more than this time. U means unusual bleeding or discharge from any part of the body without any reason. T for thickening or lump in the breast or elsewhere, any at any site or any tissue in the body. I for indigestion or difficulty in swallowing. O obvious change in a wart or mole. Sometimes whenever a mole, we all know very well, we are aware, so it is a very alarming sign. Nagging cough or hoarseness of voice. It is also time bound. If it is persist for more than 2 to 3 weeks, then it is an alarming sign, and we should go for a checkup. Probable cancer risk factors. Risk factors include the most of all we know very well. It is a tobacco, and because of this tobacco in India, the most founding cancer is next is alcohol consumption, unhealthy diet, physical inactivity, air pollution, some chronic infections such as Helicobacter pylori, human papilloma virus, hepatitis B and C virus. Hepatitis B and C increases the risk for liver and cervical cancer. So, what are the types of prevention? Being from the Ayurveda fraternity, we emphasize on this uh, as we believe that swasthasya swast aturasya vikar prashmanam. So, what are the prevention? Prevention is We can say it is primary or secondary. We can do primary prevention or secondary prevention. Primary prevention means that we should not get cancer at all. Prevention is better than cure. In other words, don't ever fall ill. Do you think it is up to you to decide whether to fall ill or not? The answer is yes. Yes, it is. It is entirely within the power of every one of us to maintain health and avoid falling a prey to illness. There is a regulatory agency in the human body that protects it against disease. This agency is termed as vital force. Or in Ayurveda, we can say the Vyadi Chamat, which controls the all over diseases, including cancer growth. In order to able to prevent illness, it is necessary to understand the factors that are responsible for weakening the vital force. The following factors enfeeble the vital force and cause the accumulation of the disease or poisons in the body. So, second is the secondary prevention. If after primary prevention, if we got ill, if we got cancer, so even we get cancer, we should not suffer or we should not die. So, primary we are taking understanding the primary prevention through diet and lifestyle changes. It is possible to prevent 30 to 40% cancers alone with the lifestyle and dietary changes. Obesity is a risk factor for cancer. So, first of all, which is the first and major cause of widest cause of the oral cancer, tobacco. We should say no to tobacco. For example, avoid cigarette, bidi, cigar, gutka, kenny. Have a healthy diet including whole grain, fresh fruits and vegetables. Intake fruit and vegetables rich in antioxidants, phytochemicals including alpha and beta carotene, beta cryptoxanthin and vitamin C and vitamin E. Maintain a healthy body weight. Next slide, ma'am. Yes. Doing physical activity on a regular basis, avoiding or reducing consumption of alcohol, diet rich in folic acid, for example, dark green vegetables. Next, ma'am. Next slide, ma'am. Vaccinated against hepatitis B virus and human papilloma virus. Avoiding ultraviolet radiation exposure, which primarily results from exposure to the sun and artificial tanning devices, or using sun protection measures. So we should choose our cosmetics very wisely, ensuring safe and appropriate use of radiation in healthcare for diagnostic and therapeutic purposes. Minimizing occupational exposure to ionizing radiation. And next is reducing exposure to outdoor air pollution and indoor air pollution, including radon. Radon is a radioactive gas produced from the natural decay of uranium, which can accumulate in our buildings, our homes, schools, and workplace. Adequate but not excessive calories. It is the main preventive measure, and I will discuss is in detail. Adequate but not excessive calories. It is itself a challenge. And how to cut the calories? We should not do overconsumption of energies or calories. It was estimated in a recent study from a prospective cancer prevention cohort that overweight and obesity account for 14% of all cancer deaths in men and 20% of those in women. Obesity is a major risk factor for cancer. On the other side, careful menu planning bring about an approach entitled CRON in the slide, calorie restriction with optimal nutrition. It was a study done by American Journal of Cancer Research Institute. So no refined sugar, no refined flour, no red meat, a balanced ratio of omega 3 and omega 6 fatty acids. It should also include DHA. It was seen that severe dysregulation of glucose metabolism is a risk factor for cancer. Omega 3 and omega 6 ratio imbalance is also an important factor. Omega 3 fats have been shown in animal studies to be protect from cancer, while omega 6 fats have not been found to be cancer promoting fats. So it is a balance of omega 3 and omega 6 which we have to maintain. Flaxseed is a source of phytoestrogen. A study was done on flaxseed, and it was seen that flaxseed provides all of the nutrients from this small brown or golden hard coated seed. It is an excellent source of dietary fiber, omega 3 fat, and lignin. The lignin in flaxseed are metabolized in the digestive tract to enterodiol and enterolactone, which have estrogenic activity. In fact, flaxseed is a more potent source of phytoestrogens. It reduces the established tumor load. It was seen in the study that flaxseed ingestion reduces the established tumor load, and it also reduces the metastasis in the known patients of cancer. Flaxseed and its lignin were able to reduce tumor growth, both in number and size of tumors. It prevents metastasis and even caused increased differentiation in mammary tissues of the experimental animals. Other researchers have tested flaxseed and prostate cancer, and it was found that a diet supplement with 5% flax inhibited the growth and development of prostate cancer. Ground flaxseed may be a very beneficial food for men battling prostate cancer. Next slide, ma'am. Supplemented with near about 2000 micrograms per day of selenium. Okay, selenium is an another mineral which is found very effective against cancer. 1000 micrograms per day methylcobalamin. It is also found very effective in the study. When we talk about selenium, selenium is a mineral found in soil and with anti-cancer properties. Good vegetarian source of selenium are whole grains and legumes grown in selenium-rich soil. So, what are the effects of selenium? I will read for you here. Selenium is present in the active site of many enzymes, including thyrodoxine reductase, which catalyze oxidation reduction reactions. These reactions may encourage cancerous cells to undergo apoptosis. Selenium is a component of the antioxidant enzyme glutathione peroxidase. Selenium improves the immune system ability to respond to infections. It causes the formation of natural killer cells. This is an important function of selenium. Selenium inhibits prostaglandins that cause inflammation. It enhances male infertility also and sperm motility. It can decrease the rate of tumor growth. Dedicate sunshine to get vitamin D or use 1000 international unit per day supplement is also very effective and useful. Uh, Ma'am, please change the slide. Ma'am, back. Let's go back, ma'am. And one more back. Okay. Okay. It is now known that over one third of cancers are preventable, one third potentially curable, provided they are diagnosed early in their course. It is very important to prevent cancer that it should be diagnosed in early stages. But The condition is that when the cancer is diagnosed, it is already in advanced stages. So that is the main cause why that is the main cause of severity and deaths due to cancer. Ayurveda plays a major role in improving the quality of life in cancer patients. An approach to early cancer detection is through population screening. Currently, screening can be advocated for the cervix, breast, and oral cancers. Next slide, ma'am. Okay, sir. In our text, according to Ayurveda, we can do Sanshodhan Chikitsa, Sanshuman, and Rasayan Chikitsa. And local treatment, we can apply Alep, Parishek, Abhyang, Upna, Agnikarm, Charkam. When diagnosed in early stages, it is only for early stages or precancerous lesions. Next slide, ma'am. It can be used in add-on therapy. Provide relief from side effects like reduced resistance to infection, loss of appetite, nausea, vomiting, and lack of energy in patients who are undergoing chemo or radiotherapy. Ashwagandha churn, avipattikal churn, chitrakadi vati, hingwashtak churn, etc. are beneficial in the above mentioned conditions. These measures can improve general well-being and can act as immunity booster to promote health and wellness. Herbs such as ashwagandha, shatavari, amalki, guduchi, bala are also beneficial. So, these above described herbs help total healing, reduce side effects, and cancer-associated complications. Nowadays, many herbs are clinical studies and being investigated phytochemically to understand their anti-cancer potential. More than 25% of drug use during the last 20 years are directly derived from plants, while the other 25% are chemically altered natural products. Now it is important to raise awareness and encourage implement of Ayurvedic therapies for combating cancer and suggest an integral approach in cancer management. Various plants having scientific evidence of anti-cancer property. These are listed below. Guruchi, Haridra, Lasun, Shigru, Adrak, Adrak, Talishpatra, Ashwagandha, Krishnajirak, Kanchnar, Bhallatak, Haritaki, Devdaru, Manjishtha. These are the drugs which are undergoing many researches are going on these herbs, and these are found very effective against cancer as an adjuvant therapy and improving the quality of life of the cancer patients. Some other formulations are Chawanprash, Bhallatak Rasayan, Brahm Rasayan, Tripla Rasayan, Navjeevan Ras, Kamdudha Ras, and Triflagrit. In this context, I one of our therapy, ma'am, please go back. In Ayurveda, a well-known therapy is Rasayan Chikitsa, and a very well-established. And I would like to share some evidence from the modern science, modern medical science also, that we all know that Rasayan Chikitsa work on free radical level. So these are the antioxidant. It provides our body antioxidants, and this research which was undergone, and I have collected data from there. They said that antioxidants like alpha and beta carotene and other carotenoids have been studied vigorously to see if these colorful compounds can decrease cancer risk. In ecological studies and early case control studies, it appeared that beta carotene was a cancer protective agent. A trial was done for beta carotene, and it was found that the isolated nutrient was either natural or actually increased risk of lung cancer in smokers. Beta carotene may be a marker for intake of fruits and vegetables, but its effect is limited. A variety of fruits and vegetables is still a better anti-cancer strategy than just using a single vegetable high in a specific carotenoid. Actually, ma'am, it's not in my slide, but I would like to tell something about something other antioxidants. I will speak. Just it is not in my slides. So, one study was done on lycopene. Like of various carotenoids, lycopene has been found to be very protective, particularly for prostate cancer. The major dietary source of lycopene is tomato, and it was seen that cooked tomatoes bring more bioavailable than that in raw tomatoes. Lycopene in the study, it was seen that lycopene slowed the growth of prostate cancer. Likewise, vitamin C. Vitamin C is quite possibly an effective substance that accounts required for those therapeutic effects are obviously beyond dietary intake. However, intravenous ascorbate may be a very beneficial adjuvant therapy for cancer with no negative side effects when it administered properly. In other antioxidants, probiotics were also seen very effective against cancer. Probiotics, the bacteria that resides in the intestinal tract, they generally have a symbiotic relationship with their host. Beneficial bacteria produce natural antibiotics to keep pathogenic bugs in check and produce some B vitamins in the small intestine. Beneficial bacterial help to food digestion by providing extra enzymes such as lactase and improving our gut immunity, and also it prevents food allergies. There is a solid theoretical basis for why probiotics should help prevent cancer, especially colon cancer and even reverse cancer. It can reverse cancer. Lower colon pH is associated with lower incidence of colon cancer. Probiotic. Ma'am, excuse me, ma'am, for a minute. Hello. 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 Am I audible, ma'am? Hello. Hello. Hello.
Ma'am, you're
Hello.
audible.
Am I am I audible?
Yes, ma'am, you're audible.
Okay. So it was found that our Rasayan Chikitsa is providing antioxidants to body and enhancing the quality of life of the cancer patients. And next slide. Thank you, ma'am. Thank you, sir. So, hello, ma'am.
Ma'am,
Hello.
You're audible,
Yes,
ma'am.
ma'am. Yes. Okay, sir. Actually, you're not audible. Yes, sir. Sir, over to you now. Thank you. Hello.
thank you, ma'am.
Okay. Okay. Thank you, ma'am.
Cancer, one of the dreadful challenges spreading drastically in the 21st century. Ayurveda, the oldest Indian medicine of system of plants, is known from very early time for preventing and suppressing various tumors using natural ways. Thank you so much, ma'am. You made us understand cancer and the preventive aspects very well.
Thank you, ma'am. So should I leave, ma'am?
Yes, ma'am, you can.
Okay, okay. Thank you, ma'am. Thank you, sir.
Thank you so much, ma'am.
Okay, actually, your voice is not very much clear.
Can you hear me now, ma'am?
Yes, yes, I'm hearing.
Yes, ma'am.